Oftentimes, people will pull together care teams to the best of their ability, and they will have a psychiatrist who says, yes, I will support you, but the psychiatrist really doesn't quite understand what that means and how that might affect medications.
So it can be really challenging to access metabolic psychiatry services for anyone, but is especially challenging for people who don't have a lot of financial reserve. So some of these services can be very expensive. Many of us who work in this space don't take insurance. A lot of these services are not covered by insurance. The other piece of that puzzle is that many of the psychiatrists and other types of mental health providers that are available to people don't know a lot about ketogenic diets. And so even if you have a great care team already that does take your insurance and you have been able to afford up until that point, they may not be able to support you in transitioning safely to a ketogenic diet. So this is a major challenge that a lot of us in the field are working on. So many resources can be useful. So the Metabolic Mind website is a treasure trove of free information for your care team as well as for you and your family. So I always direct people to the Metabolic Mind website because there's just a tremendous amount of information there that can answer a lot of the common questions that we hear, worries and concerns about ketogenic diets, what kinds of things to watch out for, safety concerns, and even how to put a team together. There are other free resources I have on my website. Diagnosis Diet is the website. There's a free clinician directory. It's international. It's growing every week, where clinicians of many different backgrounds who offer ketogenic diets for mental health care post their listings there, and you can search for free this international directory to see if you can find a therapist, a dietitian, a psychiatrist, a nurse practitioner, a coach. All different types of medical specialties are represented there. You can find somebody either in your area, or if you can't find someone in your area, then you might be able to find somebody who offers virtual services. A group of us got together. We've been putting together some expert guidelines for the implementation of ketogenic diets. And one of the things that we discussed as we were putting these guidelines together was how many keto-savvy clinicians did you need on your team in order to be able to transition safely onto a ketogenic diet? And the answer is 1 or 2 at the minimum. So most of us thought that it would be a really nice idea if you could have both the prescribing team member, trained or at least knowledgeable or experienced in ketogenic metabolic therapy, and a nutrition professional, a registered dietitian, a licensed nutritionist, for example, so that you had a dietary expert and a medical expert on your team, both of whom were familiar with the safe use of ketogenic diets for mental health. Now, there are some situations where those could be one and the same person, but what you need is somebody who understands how to implement the diet and somebody who understands how to manage the medications and the medical circumstances that apply to you. You want to plan in advance for transitioning to a ketogenic diet. Sometimes medication levels may need to be checked before you start. You may need to get other types of lab tests before you begin. And you're going to want to make a medication plan. So even before you start the diet, whoever's prescribing the medication, your prescription medicine, is going to need to plan this out with you. And then when the diet is actually implemented, they're going to need to be willing and available to adjust those medicines, because sometimes those medicines need to be adjusted even from the first day of the diet. And so it's really important to have them on board. So you want a cooperative team. Everybody understands that this is what you're doing. They've agreed to support you. And even if not everybody on the team understands the ketogenic diet, that you at least have the key members of the team who understand the ketogenic diet.
I think one of the issues that people experience when they try to pull a care team together, they talk to their psychiatrist, and the psychiatrist says, sure, I will support you on a ketogenic diet. But the psychiatrist really isn't thinking about the ketogenic diet as its own powerful, effective medication, so to speak. They are thinking about the ketogenic diet as though it just might improve micronutrients. They're thinking of it like a Mediterranean diet or a vegan diet or some other form. And those diets do not have a research base for stopping treatment-resistant seizures. So this is something else. And so oftentimes people will pull together care teams to the best of their ability, and they will have a psychiatrist who says, yes, I will support you, but the psychiatrist really doesn't quite understand what that means and how that might affect medications. And while it's ideal, and I would love for everyone to have a psychiatrist that gets it and understands it, that's just not the reality. If you can find a psychiatrist who says, yes, I will support you on this ketogenic diet, and you have a good working relationship with them where they will allow within the power dynamic for you to self-advocate, that is actually often enough. Because once the psychiatrist begins to see you improve, often they will become more curious about what is going on, and they will be more open to listening to you and hearing you and possibly getting continuing education on their own so that they can help you better. I work with people all the time who pull ad hoc treatment teams together and do beautifully. So you find a psychiatrist who's willing to help you manage medications. You find a ketogenic diet professional, and I would say preferably someone who has experience in using it for this purpose. I think I have gotten many people who come to me who are on a ketogenic diet, some who have actually worked with individuals trained in ketogenic diets, but it was more for weight loss or it was more for diabetes or something else and not for this specific purpose. And so they got quite far, but they couldn't quite get where they were trying to go to. And so finding a ketogenic professional that's used to working with this population can be very useful. If you feel like you need the help of a therapist to help you with the behavioral modification and the emotional support that can sometimes make this intervention be more effective for you, then by all means go out and get a new therapist or a therapist that can help you do that. And I've actually had people who've had established therapists, and then they will bring on an additional therapist into their treatment team that is more focused on behavioral change or some aspect that they felt might be missing. So you can get very creative and very personalized in creating your treatment team for the implementation of this. If you have a wonderful relationship with a therapist that you can continue to see during your ketogenic diet journey, I think that is just so invaluable and really kind of beautiful. And the reason I say that, which is kind of a dorky thing to say, but I think it's beautiful because as people recover, having an established relationship with a therapist that has been with you through that journey and that can help you integrate in your experience of what just happened here and who you are now and what your capacity is and what you're capable of, I think is such a wonderful piece of the recovery process.
There are many, many individuals out there who know a lot more of the science about this than their doctor or care team does. And that's always a very uncomfortable position, I think, for both sides of that. First of all, I think individuals, like I said, they're learning a lot and they should keep learning. The more the individual knows about the science and about how this might work and what's worked for them regarding dietary changes already so far, that's incredibly valuable information. And care providers should regard that as incredibly valuable information. So that's number one. I mean, number two, sometimes I think bringing, journal articles, actual research to the appointment or asking one's treatment provider. I've been reading about this stuff that I find very exciting about, potential use of these other types of therapies. And I'd like to share it with you. Are you willing to listen and talk with me about this? And would you be interested in looking at one of these articles just to see what the state of the science is and collaborate with me around, deciding whether this should be part of my care program? I think an invitation to collaboration usually is received better than this is what I'm doing and you're either with me or you're against me. I think trying to find that collaboration first, but then recognizing that some people are still going to be closed-minded and not willing to collaborate. And then I think someone's in a difficult position. They can either sort of say, well, I'm doing it anyway, I'm hoping you're going to support me, and see if they'll support. Sometimes people will come into line when they realize that this person is very determined and they're going to do it, and they will provide that support at that point. But then sometimes they won't, unfortunately. They may say, look, you can do these things, but I'm not supporting you, in which case it may be time to look around in the community for a different provider who is willing to be more collaborative. I know sometimes that's very challenging. It's hard to find the provider in the first place that takes one's insurance, that's available and has appointments and all of that. It's challenging, but it doesn't mean that someone is stuck with someone who's not willing to collaborate, because that's not likely to bring success no matter what the treatment is if there's not a collaborative relationship. I mean, I think, getting creative, really trying to figure out how to connect with this care provider, how to collaborate, it's a real skill, I think, to collaborate, negotiate when there's differences. It's an important skill in life. And yet sometimes you also have to decide, well, there's just no moving forward in this relationship. And hopefully there's other options out there in the community as well, someone who can work with the individual. If someone doesn't want to look at journal articles, there's also books, Chris Palmer's book and Georgia Eads' books. I've heard of individuals and families buying these books for their psychiatric provider. There are free CMEs on metabolic psychiatry out there that also could be great to provide those links to the free CMEs. And most clinicians are willing to spend the time to get some free CMEs. So that's another great idea, to provide the links for free metabolic psychiatry CMEs.
Thank you for watching. If you want to see more, check out these recommended videos. Also, if you haven't already, don't forget to subscribe to our channel to stay up to date with our content and help us expand the movement. And if you want to sign up for our newsletter, access our resources, read the latest research, or check out the Think Smart framework, click here to visit our website. See you on the next video.